Welcome back. In your Eye on Health tonight, there are some changes when it comes to looking at cholesterol levels in your heart health. The American Heart Association announced some new guidelines. But the real reality, what does it all mean? Most of us are too busy in our lives, and we need some good advice. So tonight we're joined by Dr. Jimmy Widmer with Baylor Scott White. Welcome.
Thank you.
Thank you for being here.
Thanks for having me.
So first of all, describe what changed for people, and candidly, including me, I know what I just read. I've seen it out there, but I couldn't sit here and quote it to you. So what changed, and also kind of the why behind it?
Sure. Well, I mean, the best way to break it down really is, you get back to cardiovascular disease is still the #1 killer in America.
Right.
And what these new guidelines really aim to do is give physicians and our patients the tools to better identify those cardiovascular disease risks and identify them earlier so that we can hopefully manage those risks and prevent the consequences down the road.
Let me cut through half the doctor talk, what I felt a little. So what you're saying is the new guidelines lower the bar a little bit, don't they? Or maybe increase the bar, depending on which avenue you're looking at it. Am I fair to say that?
Sure. Lower the bar in the stance that we previously, where we might have said, oh, you're otherwise pretty young and probably pretty healthy. We'll talk about this later on down the road.
Right.
What we do now is we can say, look, we have tools where we can better risk stratify you at an earlier age. And how can we counsel you and work with you to better modify some of those risks that down the road will lead to that cardiovascular disease.
And not to conflate, but it's also something that kind of happened in the colonoscopy world as well, right?
Similarly, absolutely. Drop that down 50 to 45, absolutely.
Earlier in life, totally get that. LDL.
Yes, sir.
I know it's the bad cholesterol. How have those target numbers changed? Because they have changed.
Absolutely. And LDL, so LDL, the bad cholesterol, as you mentioned, and then versus HDL, the good cholesterol. And we kind of get those thrown around. But we also have some additional tools that we can look at now. Apolipoprotein B. There's not going to be a test. You don't have to remember that.
Take a note.
And LP(a). So we have not just the LDL that we're looking at anymore. We have some other tools that can also help to give a better sense and qualify and quantify what your overall cardiovascular disease really is.
And even those extras that you just talked about, that's all available through just the standard blood test that you look at?
Yes, sir. Standard blood test that we would order in the office as part of a routine screening labs.
Okay.
Absolutely.
So it boils down to you're looking at more things on the labs when they come back now versus 10 years ago.
Absolutely. And we also have data that help to guide us on what to do when those labs come back.
Okay. Is there has this, and I would think the answer is yes, but guide us through it. Ultimately, if you're looking at new avenues, if you're looking at people younger, how do you approach heart disease risk differently today than maybe, say, 5 years ago?
Absolutely. So as I mentioned previously, we have the concrete data, and we can talk to a patient and say, okay, tell us about your history. Tell us about your family history. So we can risk stratify a little bit better and make sure that patient who maybe has a stronger family history, that they're, #1, aware of what that family history is. They're talking to their family, and then we're making an informed decision. Are we going to focus on the core principles of lifestyle? So, good nutrition, exercise. Is this maybe an opportunity to add a medication on, and what are those options for medications? It's not a one-size-fits-all approach.
Right.
It's not algorithmic. We can tailor these guguidelines to the individual patient.
AI is not going to solve your
Absolutely.
problem. Please, for the love of Mary, please not AI on your heart.
Hopefully I have better bedside manner.
Are there, and this is a really good one in my opinion, as far as a question, are there symptoms for high cholesterol? Because heart disease in general, the silent killer, we
Absolutely.
all know the phrase. High cholesterol is one avenue to get there, obviously, to the bad side. Symptoms.
Yeah.
What are we looking for?
We talk about metabolic dysfunction, okay? So things like central obesity, okay? So looking at waist circumference, okay? Look at blood pressure. How well controlled is your blood pressure? We look at fasting glucose. We look at some of the factors within the lipid panel to get a better sense for what's going on underneath the surface that we otherwise might have missed.
Right, and I got concerned actually recently, and I want to say maybe in the last year or two, somewhat recently, the whole blood pressure thing, that game changed as well. The numbers moved down as far as your avenue toward heart disease, right?
Absolutely. So we found that being more aggressive with that blood pressure target and really getting those blood pressures down, that baseline blood pressure, really had a big benefit when it comes to overall cardiovascular disease risk and development of cardiovascular disease.
Right, and you mentioned cardiovascular because that's where you don't want to end up. But if we end up in that avenue, you have a brother who can take care of that, do you not?
Yes, sir. I've got a very capable brother who can can take care of that. My job, what I tell patients, my job is to make sure that they don't meet him.
Yeah, exactly, exactly. And both you guys local, right? Grew up in Argyle.
Grew up in Argyle, yes, sir.
And practicing medicine in your own hometown.
Yes, sir.
How good is that?
Great.
That's the doctor, Dr. Widmer. Thanks for being here. We appreciate it. Tell your brother we said hello. You can catch this segment. His brother would argue, hey, watch my segment too. Friends and family, we will post them all on the CBS News Texas YouTube page. Doc, thanks again.
Yes, sir. Thank you.